Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes. Cold and flu season is here, and every year millions of people suffer from these illnesses. The good news is there are steps you can take to protect yourself and your loved ones. And today we're talking to Valley Health Director of Clinical Pharmacy, Dr. Joel Turley, about some changes with the pneumonia vaccine and why we need to consider the flu vaccine and different things we can do to be healthy. Thanks so much for being here.
Thank you.
Let's kick it off with the pneumonia vaccine. What's different about it this year?
So recently, the CDC and the Advisory Committee on Immunization Practices, ACIP, have revised the age recommendations for the PCV20 or pneumococcal conjugate vaccine that covers 20 different serotypes of invasive pneumococcal disease to be eligible or to be available to patients 50 years and older, when it was previously only indicated for patients 65 years and older. So in an effort to help reduce the amount of pneumonia throughout our communities, they've approved that, and it's now available for all of our adult and older adult patients.
So instead of 65, now recommended at 50.
Mm-hmm.
Why is this such a big deal for community health?
Well, pneumonia can be a very severe disease, and an ounce of prevention is worth a pound of cure when it comes to preventing hospitalizations, antibiotic use needed to treat pneumonia, and all of the other side-along effects that can come with a severe pneumonia infection. So protecting against those 20 different strains of pneumococcal infectious disease has been very beneficial for our elderly population, 65 and older, and it's shown so much benefit that they wanted to reduce the age to 50 to help prevent pneumonia in our communities.
What should patients know about scheduling this vaccine? Is it different than others?
Previously, there were other pneumococcal vaccines, the PCV 13, 15, and PPSV 23. The PCV 20 has, by and large, replaced most of those prior therapies just because it's that much more effective in preventing pneumonia. I don't believe that there's any particular scheduling conflicts with other vaccines, such as pneumonia or such as flu or shingles. It's not an active or live vaccine by any stretch, so it generally has a side effect of a little bit of arm soreness, I think, is the primary complaint that patients have after getting it.
Okay. You brought up flu. It's coming around again. Why is it important that people consider a flu shot every year, even if they've been healthy in the past?
So getting a flu shot every year helps protect you for the 6 to 8 months that the flu is strongly circulating in the northern hemisphere. It generally covers about 4 different strains of flu that are determined by the CDC to be likely to be what's the circulating dominant strain within the United States during our flu season. So getting an updated flu shot every year helps give you a little bit more protection in addition to your previous year's shots.
What's the best time of year to actually get vaccinated for the flu?
So starting in September is probably the best time to get vaccinated for flu, but you can still see benefits getting it all the way up into December. The flu shot takes about 2 weeks before you create or generate the protective antibodies from the flu shot. So if you get the shot very late in the season, then you will likely run into the flu before your flu shot is working for you. And that's why we try to encourage folks to get a flu shot relatively early, September, October, before the flu is strongly circulating in the December, January months.
Yeah, try to get it and get the prevention in before it's everywhere. All right, Dr. Turley, thank you so much for all this advice. We sure appreciate it. Thanks for checking in on Monday Health Minutes.